perfect. Yes, so I am Meggan Graves, and I am a large animal emergency clinician at the University of Tennessee here at the College of Veterinary Medicine. My position is a little bit unique in that I'm mostly farm-based, so a mobile unit out on the farm.
Thank you, Meggan. Caroline, would you like to introduce yourself?
I'm Caroline Wienhold. I'm in the Division of Biology, and so I'll be talking the second half on working with large courses. Our classes are usually around 200 students, and Ben Keck will also be joining me after he finishes teaching, and so he'll be running the second half with me.
Thanks, Caroline. So I'm going to hand it over to Meggan to get us started.
All right, well, thank you for joining us today. I was pretty honored to be asked. I had worked on this project for quite a while. I guess it started several years ago, actually, but I'm sort of the initiator of this learning tool, and I worked closely with Miriam Larson. She's an instructional designer and developer at the University of Tennessee's Office of Information Technology, so the OIT department. And we worked closely to complete this project as part of a Faculty First grant. So my session today is going to highlight the design and development of a series of real-world scenarios that are designed for fourth-year veterinary students. We named them, you got to have something catchy to go with something when you design it. And so we called them veterinary emergency treatment scenarios, or VETS. And it doesn't replace hands-on learning. We never want students to think that that's our goal, which has been a struggle with clinical students during COVID, especially, to take away some of their hands-on learning at times. But this is simply meant to supplement their clinical rotations and hopefully help us prepare students for private practice, which is typically our goal. Most of our students do go into private practice, and a small handful might go into academia. Let me just make sure my slides are not advancing. Let's see. There we go. Do you guys see that then? Okay.
Yes.
So in this presentation, I'm going to cover some of the background on the project, a bit of our pedagogy and design, and then briefly touch on the production and implementation of these modules, as well as share some preliminary evaluation results and some lessons that we've learned from this experience. And then last, but certainly not least, I will take you on a little brief tour of the modules. So let's get started. This project began really as a simple idea of how to provide consistent experiences and learning activities for students in a more creative way than simply sitting around a table and discussing them. Talking through cases and emphasizing clinical presentation, medical management, and those side of things with hypothetical patients is really a favorite learning exercise of a lot of veterinary students. But the rate at which those individual students progress through cases is really quite variable. And I'm not sure if some of that is related to the group setting or if it's related to personality, experience, even their knowledge base. But with 85 to 100 clinical students coming through our clinical year of our program each year, the variability and the pace that they learn is important to address. And so it sort of exposed the need for self-paced interactive modules to allow these veterinary students some flexibility, not only in the time that it takes them to work through the cases, but also if they want to dive deeper into some supplemental materials as well. So these online problem-solving scenarios not only provided consistency for the student experiences, because certainly with emergency medicine like I do, you never know what you're going to get. So this provided a little bit of consistency for those learning outcomes, but it also helped to work on developing learner confidence. And I'll explain a little bit more of that as well. So one thing that really helped me sort of realize my vision for the program was the support that I received from the OIT Faculty First grant. The grant provided me the expertise that I needed to accomplish the technical side of things, which the technical side of things was a lot more than I really had envisioned from the beginning. But the innovation and the resources through OIT really made this idea come to life. And it allowed me to work on the content rather than having to think about the technical issues and things like that. So Miriam Larson was the person that I worked with specifically, and she spent a ton of time on the project as well, but her time was spent on the technology side of things. Again, my slides. I'm not wanting to advance. There we go. The basic idea was basically assessing the patient using clinical reasoning through history taking, a physical exam, and then diagnostic and tests and exams that would help you determine a diagnosis and then develop a treatment plan. The web-based modules cover common clinical cases created with the objective to focus on fundamentals in triage, disease recognition, diagnosis, and then emergency medical treatment. Problem-solving skills and stepwise diagnostic reasoning, those are critical tools, especially in the emergency field, because you have this urgency of case decision-making, but in the field, you have to have some of that knowledge, because the ability to apply those skills is, your resources are often limited when you're in the field. So at the start of the project, I simply provided Miriam with my vision for the type of learning experience that I wanted to provide my students. I had 2 scenarios kind of fully outlined out and 2 other ideas kind of in the works. And I had all the types of questions that I wanted to ask. So Miriam's goal was to come up with a format or a sequence for the scenarios that could easily be replicated by me or anyone else in the college that wanted to build more cases beyond our first 4 scenarios that we had planned through the grant. Before Miriam could do that, though, she really needed to understand a bit more about what is diagnostic reasoning and how does that work. And so we had a lot of fun sort of laughing about animal related things and where I stick my hand for a living and things like that. And so she basically was able, after asking me some questions and doing a little bit of research, we came up with this progression or flow chart that you see here. Well, actually, it went through a lot of iterations before we kind of came up with this final product, but this is sort of the final version of what that looked like. And then we agreed that each scenario would basically have roughly the same number of initial history questions so that the template could be set. And then she began to build out a prototype. And we went through a lot of prototypes before we came up with something that we really felt like we could test on students. And so Miriam, she spent hours on the development side of things, and we did that sometimes together. We did some things separate and then came back together. And then she spent a lot of time on the phone with Articulate. Storyline was the software that we used, and Articulate technical support really helped her try to make the scenarios as accessible as possible. She had some OIT students that would test for accessibility, and then I had a few of my veterinary students that went through the scenarios to identify any glitches, anything that was unclear as far as content goes, and then items that they felt maybe needed to be added. And so after finalizing all of those inputs, we rolled the program out. And in the final year of veterinary school, students, they rotate through clinical services for hands-on learning, and it's very case-based. And the students are given access to these particular modules upon entering what's called their field service rotation. And they take 2 field service rotations, one for farm animal and one for horses. And then they're given 2 weeks to complete the modules at their own pace after finishing farm calls during the day. At the completion of every scenario that they go through, there's a brief survey, mostly for us to gather feedback. And the survey asks the participants to rate their confidence before and after taking each of the modules, rate their knowledge before and after, as well as some of their abilities in areas that are relevant to the scenario. And although we're still in the early stages of rolling the program out, all the students rate their knowledge and confidence higher after the scenarios than before. We also ask students to share strengths and weaknesses of the VETS program. The students note the strengths to be the low stress atmosphere, sort of that stepwise logic to working up a case, and then just good practical information. Most of the students state the weaknesses of the modules as none, but there have been a few that note the lack of hands-on learning, which is a bit tricky with an online module. And despite Miriam's magical technical abilities, she was never able to figure out how to have a student actually rectal a horse through a computer screen. But knowing Miriam, I'm sure she'll figure out a way to do that eventually. But I'll take you on a little tour now and kind of show you what that looks like. And you can read through some of these quotes on just, you know, how the students feel about the program. And it was really gratifying actually to notice that they appreciated the stepwise to it, and they valued sort of the practical real world setting as well. But here's a little tour, and I will eventually, these are sort of screenshots from the modules, but I eventually will switch us over to the modules themselves, just because it makes it a little bit easier for you to see some of the interactions. But each case begins with a consent statement, basically explaining that veterinary medicine is an art. It's not an exact science, and these are certainly not meant to be a cookbook with a detailed recipe of how to treat cases. And we have to be very cautious of that, because a lot of students do want that, but that is not what it's about. And so each student must accept that consent. And once they do, they're directed to select one of the 4 current cases that we have available. So a horse, a goat, a camelid, and a cow. You'll also notice that there are navigation tabs for instructions there at the top. There are also links to white papers and other resources as well. They can even click certain textbooks that will take them directly to library links for library accessible textbooks. So that's where students can, you know, access a resource and spend a lot of time reading more about things. Each case will start with a scenario of why the owner is calling. Again, based on accessibility, you can push play and you can hear a recording of our fictitious owner talking to you on the phone. And then it's followed by a series of questions that the student can then choose to ask or not ask to gain further insight on the case. We do make it to where this is sort of like a you choose book. And so you do kind of get to navigate it, but ultimately, because the branching was just so enormous of choosing which way you could go, we ultimately do have to guide the learner a little bit. And there are certain questions that we mark as mandatory that they would ask, so that they can kind of get all of the whole picture of what's going on. So I'm going to switch us over real quick to the modules. Let's see if I can stop sharing and then switch my screen real quick. And you should be on the scenarios now. And so once they've gone through asking those questions, are you guys seeing the right screen? Do you see a picture of my truck now?
Yes.
Okay, all right, perfect. And so the students then, after they've gathered it, they have to load their truck. So they have certain items that they can click that will be loaded on their truck, and they can keep them on the truck or not keep them on the truck. And this actually proves to be very valuable, because if you fail to bring a piece of equipment with you, you can't use it later on in the scenario. So that's where things become much more interactive as well. And so after they have sort of chosen what they're going to need, and they are guided that, no, you're not really going to need an x-ray potentially on this case, and so you can take that back off the truck. And so once they've done that, they'll be able to see sort of what we thought they might need, and then they can go back and add those things, or they can continue. The other thing, as they work through the scenarios that you'll see, are these tabs will start popping up along this left margin. So they can go back and look at their history questions and the answers they received. They can look at their truck, and as they perform more diagnostics, those show up as well. So after they have done that, then next the learner proceeds through a series of diagnostics, which includes a physical exam where they must count the heart rate for themselves. So you can take a listen here. And if they don't know how to calculate a heart rate, there are tabs where they can reference that as well. And then they use the sliding bar to see if they got that correct. If the learner remembered the right equipment, which thankfully for you today, I did put an ultrasound onto your truck, they can perform things like an ultrasound where they can click certain areas and view photographs of images from that part of the abdomen. And there are several that could be relevant for them, as far as seeing where the kidney is and that there's not, a displacement or something like that that they would be concerned about. So several images throughout for them to view. And there are also instructional videos that are strategically placed throughout each of the scenarios. We have videos that include placing IV catheters in goats, passing nasogastric tubes in horses. In the cow scenario, we show them how to perform an epidural. And then as you see here, this is in the camelid one where they are performing a CSF tap. Most of our videos have sound that kind of walk them through it. This video is strictly for them to observe the procedure. I hope everyone is eating their lunch. I tried to include videos that would not be necessarily repulsive for some people that are having their brown bag lunch right now. So I'm gonna again switch back over real quick to our other screen. And so after they have, and hopefully you see that now as well. And so after they have done that, as far as working through, there are a lot of quiz questions throughout the scenarios as well. So you can see here, they've looked at a PCV and what exactly is that. And after they do that, then they narrow down their differential list. So they started with an initial, what do you think this is? And now after performing certain diagnostics, they get to narrow that differential list even further. And then eventually they will hopefully come up with their own diagnosis and then come up with their treatment plan. And then finally, they'll put together some discharge instructions or choose from an appropriate discharge instruction. And then that would complete the module. But because that wouldn't really be fair for you to see just this picture, I'll pop you back over to the real scenario, because what you actually get at the end is wonderful sounds from each of the scenarios. So that is the orgling sound of the camelid. But then in addition, they get this interactive certificate where they can place their name into a certificate, which then can be printed and could be used for credit as well if they were going to utilize that credit, which we don't have right now in our scenarios. It's not being used for credit in the classroom. Let me switch back over here to the slides one more time. So we did, like I said, we have these surveys, and so far we have 221 completed surveys. We actually rolled this program out in May of 2019, and so we've had a couple overlaps of some different classes, and we have had a couple dropouts in the scenarios, and there are different reasons that we could attribute to that. A few could be that maybe it's just the current demands on students and, one more survey kind of thing when they're online, but it also could be the lack of accountability, since right now, like I said, this is strictly supplemental. It's not part of their grade. We also have some students who are predominantly small animal focused, and so they may not be interested in completing supplemental material. And because I'm after hours, I don't see these students every day to remind them. But since sending out reminder emails and also having the day technician remind them, we jumped from 80 completions in the fall to now this 221. So that's also increasing. Students, like I said, they'll rate their knowledge and ability. They rate it 1 for poor and 5 for being excellent. And so just for example purposes, this is the camelid case scenario that we have so far. And the percent improvement for the case task is particularly high, actually ranging from 34 to 54%. Proper Fromancia technique received a low improvement score of only 8%. And this may be due to the high understanding by students because they do get this in some of their preclinical laboratories, or it could just be a limitation of our video. This was one of the techniques that we demonstrated by video. And Fromancia is a technique where you assess mucous membrane color to subjectively determine levels of anemia. And we made the video to demonstrate the technique, but there's a scorecard that goes with it. And the students do note that they'd like an up close photo of the scorecard, but because of copyright restrictions by those that founded the Fromancia scoring system, we can't actually do that. So we'll need to look for other ways to improve that instruction. The other one that is sort of lower is the body condition scoring, but it's 24%, which is still actually pretty decent. Student responses, as far as how can we like feedback for providing more possibilities for future scenarios. Some of them suggest a printable transcript for some of the instructional videos because there is an outline of sort of how to perform some of the tasks that we do demonstrate. They love the little quick videos throughout, so perhaps implementing more of those. There have been some students that would like to have drug calculations and a summary of common dosages, but I'm a little apprehensive to do that because this may be a student that's looking for more of a cookbook and not actually an educational tool. So I'm a little reluctant to do that one. And then, you know, notifying the user that sound is required. Obviously, it's startling when you heard that llama at the end, but having your sound on does make the whole interaction go much better. So that's basically the VETS program. In brief, we learned a lot from this process, and we believe that we designed something that really does prompt learners to problem solve and to engage diagnostic reasoning. I think it will better prepare veterinary students for professional practice by engaging them in thinking skills and problem solving that they wouldn't necessarily get in the field on just a 2-week rotation, because these might be cases they might not see. And I think if nothing else, if you just take away what cross-campus collaboration can do, because I would have never been able to develop something like this without the Faculty First grant that I had. So with that, I see a couple questions or comments that might have popped up in the chat. I had that closed while I was doing this, but I can see, yes, watch what they spit out. That's exactly right, Jeremy. And that sound actually, if you really want to know, Caroline, is a happy sound because it's sort of their sex sound. So I think because it's their sex sound, I think it would be considered a happy sound. But does anybody have any questions that I can entertain about these scenarios, or anybody else working on online modules, something similar to this?
Yes, it's Ashley Hartley. I'm one of the small animal clinicians in the vet school, and this is really exciting as a tool, especially for our small animal students, because I think it's great to practice different scenarios. Obviously, this is a cross-campus lecture that you're giving today, but it's exciting from that side. Have you gotten interest from the small animal side from that?
I have, you know, I presented this at one of the master teacher programs there at in our college or whatever. And yes, Dr. Olin was very interested. And I know that she would love to add on to things as well. And so we have been looking at how to take storyline and maybe give you guys your own, because you buy, you know, sort of that little copyright. And we did an educational one. We've actually gotten interest from some other universities as well. So LMU has reached out to us to see if they can utilize the scenarios for their veterinary students as well. So we're exploring that, but the potential is there. The time to carve out, you know, in order to develop this, I think has been the biggest challenge.
Absolutely.
Because, you know, when I think when Shelley asked, like, how much time did it take? Miriam and I calculated up our hours, and it is a bit of a deterrent, but I think so much of the legwork has been done at this point that I certainly wouldn't say it would be easy, but if somebody had sort of a case, it's very doable. It certainly wouldn't be easy. The videos, we also got quite a bit of help. Jason Brown did our videos there on main campus, and to have a professional videographer, and then I had to go into the studio and record. I wish I could have gotten some fabulous Morgan Freeman voice or something like that to do them, but unfortunately it was just my voice that went over all the videos. But you know, to have help in that area would have been great as well.
I have tried like with PowerPoint to create scenarios, but you're right, the branching and so forth, having those examples, the videos are really dynamic for the students, especially during this time. So it's a really great platform and test that you've done. So I'm glad you've taken the groundwork for the rest of us, but from like the veterinary side and teaching, it's a great tool for students. So thanks.
Thanks for your feedback. I'd love to see more people using it. I think on small animal, I know, like I think Dr. Schilt has some ideas. She has some modules that she has put together as well. But yes, to answer your question, they are integrated into Canvas. And we have a way to do it as web-based as well. So we can distribute them. And we actually went through, well, I'm going to forget what what it was, but we did go through sort of making it a UT product so that if we distribute it other places, we're sort of protected in that way as well. But it can be web-based, it can be placed on a CD to be utilized that way as well. So it doesn't have to be just through Canvas. And we used Articulate Storyline as the software program that we developed it. As far as how easy is it to modify once the framework is in place, it's actually not that difficult. So there's a nice little template and you can just go in and change. Because we have each of the scenarios sort of similar, you could copy one scenario into a new scenario and then just change the questions or the videos throughout it to make it work for the next case. So easy, I think, is relative for those people that are more technically advanced than some of the others of us. But yes, relatively easy.
Hi, this is Brady. I'm in the ophthalmology service at the vet school.
Yes.
And I find this really awesome. So super commend you guys for coming up with this idea. I love it. I would really be interested in adding scenarios personally for ophthalmology, but what is your vision in terms of having this replace or just supplement any kind of didactic rounds or other kind of rounds with the students? Like, would you find that this would be maybe a better scenario than doing didactic rounds with them?
I think that depends, you know, some of it, because sometimes they have questions outside of the scenario. So I don't know that it can exactly totally replace it. But I do think, you know, especially during COVID, when we in the field found ourselves still having to see like cases, but we didn't have students with us. So then, you know, how do we entertain those guys? And then for me with emergencies, there are nights where the student never gets an emergency call and they're only on call a handful of times during that 2 weeks. And so I think from my perspective, it was really valuable. Or even for your rotation, you know, you might have things that you consider pretty common, but for 2 weeks, you didn't see one of those. And so to be able to have a case that they can work through, that is something they will see in real life, but maybe they just didn't see it. Just for consistency's sake, I think that's where it's probably most valuable. The Faculty First grant that I got, I would really encourage you to look into that for the technical support side of things, because they already have this template. Miriam does, and I do, but then, you know, adding more to it, it is time consuming, and that grant would allow for some video making on your side of things, even just the ophthalmic exam and things like that. And you know, it's funded every year. And I think because it has been a success, it would be more likely to be funded even in the future for more cases. But I think it would be hard to juggle clinics, to juggle teaching, and to try to, you know, keep building more cases without some technical support. So that's kind of how I would suggest going about it. But I'm happy to share everything that I have. We would love for people to do a spin-off on small animal cases, for sure.
Thank you.
I would like to revisit Jeremy's question. He asked the tool that was used to develop it. And Jeremy, he said Storyline 360 is not free. It is subscription based, so you don't have to pay for it unless you have some funding for that. And then how do you add it to Canvas, right? Because you have to create it in Storyline and import it into Canvas. And if you look at the Canvas course, the menu on the left, you see somewhere it says SCORM. So it has to be exported as a SCORM package for it to be exported in Canvas. And then any change you want to make, you have to go back to Storyline 360 to make the changes and then re-export again into Canvas.
Yes, sorry, that I'm thankful you're here. And that was part of my grant, you know, paying for that subscription. And we started out as an educational one, and then we ended up modifying it into a professional, or one that we could actually, if we want to sell a CD to an LMU student, we can do that now because of our the different copyright that we went with.
And the other thing I also wanted to mention, Jeremy, is there is also another one there that because Storyline 360, you can install the program on your computer and run it, and it works mostly on Windows computer. If you want to use it on the Mac computer, you're going to have to make some changes, right? But the other thing, the other one that you can run on a browser is called Rise, R-I-S-E, and you can use it that one is fairly easy to use in the browser. You can also use scenarios in that as well. And if you go to the website is articulate.com, you can sign up for all of them, 1 month free trial, and you can go in and play with it and see how you like it, and see how you like it. Hope this is helpful. Okay, does the bill work independent of the subscription after subscription is paid? Well, yes. So say you finish, you created it, you have the export package, right? You can, yeah, if your subscription ends, is as if it were a Word document, right? So it can be opened anywhere someone has a Storyline 360 app.
So it's like an emulator. It runs on its own once you build it. You don't need the continual subscription over and over again in order to modify it, but it still works independent of the subscription once it expires.
Yes.
Okay.
Still works. Yes.
Did you try building a framework like this within Canvas, just using native tools in Canvas before, or did you feel like it just was not something you could do in Canvas?
You know, that's an OIT question. So they kind of brainstormed on kind of looking at how my branching was going to go and what the idea was. And they're the ones that came up with, I think, Storyline software would do what you need it to do. We didn't try anything in Canvas. We went straight to Storyline.
Yeah, I don't think you can actually do it. You can do any branching in Canvas. Like, you know, what Storyline allows you to do, you can't do that in Canvas. The only thing perhaps maybe it will be with quizzes. Someone chooses a yes or no, whatever, and then takes them to another question stuff. But Canvas is very limited in terms of, you know, what do you call it, scenario-based activities. Yeah.
Thanks for y'all's questions and encouragement. Makes me glad that we spent a lot of hours doing that, and hopefully more people can use it.
Thank you, Megan. Thank you for leading us today. It was great, very informative. Caroline,